welcome to Health Mantra, your window into the latest in health and wellness. I'm your host, Heather, and today we're going to be talking about one of the latest advancements in spinal care, a minimally invasive technique that offers not only reduced pain, but also lesser recovery times and a whole new way to treat many spinal conditions. I'm talking about endoscopic spine surgery. And to tell us what it is and exactly why it makes such a difference, I have in the studio consultant in spine orthopedic surgery at Manipal Hospitals, Goa, Dr. Sunny Kamat. Hello, Dr. Kamat, and thank you so much for joining us here today.
Hello, Heather. Thank you, Heather and Prudent Media for having me today.
With an MBBS and an MD in orthopedics, Dr. Kamat has undergone advanced fellowships across India and Germany, including a prestigious fellowship in endoscopic spine surgery at Schoen Hospital in Munich. He specializes in many minimally invasive techniques, spinal trauma, spinal deformity correction, and sports injuries. Dr. Kamat, let's start with, before we get into the nitty-gritties, let's start with a very simple, what makes endoscopic spine surgery different from traditional spine surgery?
Endoscopic spine surgery is currently the most advanced surgical technique which is used in spine surgery. In this, what we use is that we use a scope and we insert the scope through the skin with a very small incision. And with the help of the scope, we are able to visualize the delicate structures of spine and under a very good magnification and with the good visualization. So you can do the same surgery with a very small incision, with a better precision and with better safety profile than the old traditional spine surgery, which commonly required incision which is much larger, for example 5 to 10 centimeter, which involves stripping and damaging or cutting the normal muscles, bone, just to enter into the spinal canal and to do the nerve decompression.
Are there many spine conditions that can be treated using this method?
Yes, of course. There are multiple conditions which can be treated with this novel technique. The most commonest is slip disc or disc herniation anywhere in your spine, mostly the lumbar or the lower spine, the lower back, which is most common in young people, especially who are like techies or sits for long hours, or young people who go to gym. And there is a condition called as lumbar canal stenosis, which is usually seen in elderly patients. This is usually because of the growing of extra bone and extra tissue called ligamentum flavum, which causes further nerve compression and sciatica kind of symptoms and maybe weakness, numbness in the legs, also back pain. And tumor, yes, certain tumors can be treated with this technique. Spinal infection can be treated with this technique, and as well as spinal trauma.
Doctor, you spoke about young techies. On the other hand, you also spoke about the elderly. Would this procedure, is there an age limit for this procedure, or does it benefit everyone?
That's the beauty, Heather, of this procedure. There is absolutely no age limit for this procedure. It can be done in as young as 16 to 17-year-old patient and as old as 80 or 80 plus the patient. The best part of this using in elderly patient is that it causes minimal trauma to the muscles and minimal bleeding and less pain, and helps in faster recovery of the patient.
So less pain, reduced trauma. Are there any more key benefits to this method as opposed to, say, a traditional open spine surgery?
Yes, of course. As the name suggests, this is a minimally invasive spine surgery or the least invasive spine surgery, because of which we end up not damaging any normal spinal muscle. We don't cut any spinal muscle as we do it in a traditional spine surgery. And because of which there is a faster recovery and there is less pain after the surgery. There is less back pain usually, which is very common after the surgery because of the big incision and a lot of cutting of muscles and normal tissue. And the complications are extremely less. You can say very minimal complication because of this because of the better visualization and magnification of the tissue. You can't go wrong in this kind of surgery. And definitely a small incision means very small scar, and which is hardly visible on the back as compared to the big incision, which is absolutely evident or visible on the back. And these are the one of the common advantages of endoscopic spine surgeries.
So you said, you've spoken about so many benefits. You've spoken about it being beneficial for youngsters, young techies who sit for long hours and thus develop, say, back pain, as well as the elderly who develop other kinds of problems like your sciatica and herniated discs. Now, what I'm trying to say is when a patient walks in with spine-related pain, is everyone eligible for endoscopic spine surgery? Is there a way, do you have imaging tests to determine whether a certain patient, needs to go for, say, your minimally invasive surgery, or how do you do it?
Yeah. So first, let me be clear on this. Any patient who walks in my clinic, most of the patient don't need surgery. 90% of the patient can be managed without surgery, and the surgery is indicated only in 10% of the patient. So 90% of the patient can be treated with medicine, rest, physical exercises, physiotherapy, strengthening of back muscle, core muscles. And the rest of the 10% of the patient who will end up with back pain as well as leg pain or the radiating pain, which we commonly call as sciatica kind of pain, which is not responding to medication, not responding to physiotherapy, and which also involved with burning sensation, numbness in the legs, difficulty in walking, difficulty in sitting, sleep getting affected because of the pain.
Because of the nerves.
Yeah, because of the nerve compression. These are the candidates who usually need spinal endoscopic surgery.
When we talk about, let's talk about the procedure itself. Now, is it a long procedure? How long does it take from start to finish? Is it a lengthy procedure? And could you give us a quick overview of what happens, say, on the day of the surgery? I believe you've brought in some tools to demonstrate this.
Yeah.
They look scary, but okay, let's go.
I'll be as simple as possible with this. Okay, so the procedure is very simple. A patient comes in the morning, fasting, and after the admission in the morning, we post the patient in the afternoon for the surgery, and patient can be discharged within 24 hours of the procedure.
Okay, that's quick.
Yeah, that's very quick, and sometimes even the patient can be discharged on the same day.
Oh.
Okay, so what happens is that in endoscopic spine surgery, we put a very small incision on the back, at the exact level which needs to be operated. Okay. Incision is less than 1 centimeter or 8 mm, you can say.
Okay.
It ranges between 1 centimeter to
1
centimeter to 8 mm. So it is hardly the size of a peanut, you can say.
Okay.
Okay. And with that, what we do is that we have this scope. That's why it is called endoscopy. The scope, it has a diameter of around 8 millimeter.
Okay.
And it has a working channel where we put instruments, and it has a light source to visualize the structure, and it has a camera lens. So if you can see, these are one of the commonest instrument what we use. So such a tiny instrument goes into this tiny scope, and with this, we are able to remove the disc prolapse, or we can decompress the nerve by removing the compression around the nerve.
Okay.
So the small incision, the scope gets inserted into the back with a small incision, but tell you this scope doesn't enter into your spinal canal. It doesn't damages your nerve. It doesn't enter into your spinal cord. it just remains above it just to visualize the structure.
The scope.
The scope. The scope doesn't touch your any of your normal anatomical structures which are there in our spine. It is just for the visualization and to put the instrument. So with this, the advantage is that we can immediately spot on, or we can immediately go to the place where it is required, or where the problem is, without stripping the tissue, because the stripping of tissue requires a lot of time because of the big incision. And with the help of this instrument, we can go to the place where it is needed within 5 minutes. Okay. So the total length of the procedure is around 30 minutes to maximum 45 minutes.
Okay.
Yeah. And patient is able to walk on the same day of the surgery.
Oh, all right.
And patient can be discharged on the next day. Most of the time, we keep the patient 24 hours just to be sure that, under observation. Otherwise, technically, you can discharge the patient on the same day of the surgery. They do it in Europe. They do such kind of surgery on the daycare. And patient immediately feels pain relief immediately after the surgery.
Oh, all right.
Yeah. And after the surgery, patient can go home, like as I told you, within 24 hours. He can drive the car within after 2 or 3 days, and he can resume his duty after 3 to maybe 2 or 3 weeks of the surgery.
So normal activity within
normal
2 or 3
activity
weeks.
Patient can resume after 2 or 3 weeks.
Even
of the
though
surgery.
those look like some instruments of torture.
No, it doesn't. The surgery is done under anesthesia, so the patient doesn't experience any pain
at all.
We make sure the patient is absolutely comfortable, and patient don't remember any pain during the surgery. Even after the surgery, there is bare minimal pain.
Reduced pain.
Yes, absolutely less pain as compared to the traditional spinal surgery.
So I think this would be very good for those who are hesitating, to do something like this because of the pain involved.
Of course, yes. So this technique is the most advanced surgical technique in spine surgery. So this technique has evolved in last 5 to 10 years, and it's commonly practiced in Western countries. In India, it has been it started in last 5 to 6 years, and there are a lot of publications, studies, and articles which proves that the endoscopic spine surgery is much superior than the old traditional surgery in delivering the results.
Doctor,
and patient safety.
You spoke about a lot of studies. Now there are a lot of studies also against it, to do with, say, CSF leak and all of this. What do you have to say about that? I mean, there is a lot of fear because of recurrence, one, and two is because of things like, say, CSF leak, because it's a clear fluid, so you can't really perhaps see.
Yeah, so it's very simple actually. During the surgery, because of the magnification and the illumination of the light source, the spinal structures are so clearly visible that you can't go wrong while doing the surgery. So even a small rent into the nerve can be detected with the help of this instrument.
Endoscope.
Yeah. So best part is that what we use is saline in this while doing the surgery. So it is like you are diving into the saline, and because of constant flow of the saline, there is not much bleeding you can see. As compared to the traditional surgery, there is a lot of bleeding which usually happens, and because of the bleeding, you can miss the important structure, or you can cut the important structure because
you
cannot see. But in this, since everything is flushed out, all the blood is flushed out, and the vision is absolutely clear, you can detect even the smallest CSF leak with in the nerve root or in the dura. A small rent you can detect. So the chances of complication, as I told you, is very minimal, because if there is dural leak or if there is rent, it is detected and it can be treated there and
immediately.
Immediately.
What about recurrence? Are there complications that recur? Would like the pain recur?
Yeah. So this is just like any other surgery which has its own complications, but the complications are minimal, as I told you. So during the surgery, we take utmost care that there is no recurrence. But theoretically, there are some chances of recurrence because we don't remove the entire disc. We have to keep the disc which is not bothering you.
Okay.
We remove only the part which is bothering and troubling you and it is of no function to you. So whatever remains inside, theoretically it can come out. Okay. But the chances are minimal.
Doctor, now you said that it's a relatively new technique. Is it safer today as compared to, say, 5 years ago? Have there been, any new tools, new technologies that have developed?
Yeah. So this is a newer technique in India, but this is time tested in the Western countries.
Oh, okay.
Yeah. So and most of the Indian surgeon, they have to go to the Western country, in Europe especially, to learn this technique, or in South Korea to get trained properly. And definitely it has a learning curve, but a well-trained spine surgeon can quickly pick up this technique and you can start away with the surgery. And in Manipal Hospital, we've been doing this surgery for last more than 2 years, and we have done more than 70 to 80 cases, and fortunately all cases are doing well. Most of them are doing well.
Okay.
And none of them resulted into any complications. And I'm very happy operating with this technique, because day by day I'm getting much more comfortable, and this because of the visualization and the minimal access technique, the recovery what we see in the patient, satisfaction, the happiness on the patient face is remarkable. So this is my go-to as of now when it comes to spine surgery.
What about patients who've had, unsuccessful, say, open spine surgeries in the past? Can you still do an endoscopy?
Yeah, you can do endoscopy with old spinal surgery patient, but only the endoscopy will not help you. We have to do something called as fusion as well. 90% of the patient, we usually recommend fusion along with the endoscopic spine surgery. But it can be done.
That's good, I think. Doctor, you also said that, a patient can go back to work with, they can drive a car within 2 or 3 days. They can go back to work within 2 weeks. But is there physiotherapy? Is there rehabilitation involved even after a procedure such as this?
Yes. Definitely, you have to undergo a physical rehab at least for 2 to 3 weeks to strengthen your back muscle and to strengthen your core, so that you don't land up with recurrence, or you don't land up with the problem at another level. So this physical rehab is absolutely necessary after the surgery.
What about lifestyle changes?
Yes, of course. Lifestyle changes is highly recommended, even if you are having, if you have undergone surgery, or if you have not undergone any surgery. Okay. So, for example, the ergonomics, how you sit, your posture is very important, because most of our work today is in the sitting position, and your posture should be upright. And people who walk on computers, the screen should be always at the eye level, so that you don't slouch and flex your neck. You have to take breaks every half an hour, 45 minutes, go walk around, come and stretch, and sit again and start your work again. And you have to make sure that you don't gain weight, and regular walking, regular exercise is highly recommended.
As is for everything else.
Yes, yes.
All right, Dr. Kamat, let's do a quick round of a fact or myth. I will read out a statement. You tell us whether it's a myth or a fact, and then if you can give us a quick explanation. So let's start with the first one, which says endoscopic spine surgery is still experimental.
It's a myth. There are many, as I told you, many articles and studies which has a randomized controlled trial, which has proved that spinal endoscopic surgery is as safe as the old traditional surgery, or sometimes better than old traditional surgery in delivering the results, and it is much safer also.
What about the one that says minimally invasive means less effective?
Myth. Minimally invasive means it is highly effective when done properly. Today's motto is small is enough. So the world is moving towards minimally invasive surgery, for example, laparoscopy in general surgery, and there are others minimally invasive technique which is used in other department of in medicine. So definitely this is a pioneer technique.
All right. The next one, back pain always requires surgery.
No. As I told you, 90% of the back pain don't require surgery. You need more lifestyle changes. You need medication for a few days maybe, and some physiotherapy, and 90% of the patient recover from back pain.
All right. The next one says that spinal surgery means you'll never be able to bend or lift again, never be able to play sports again.
Myth. To be very honest, most of my patients, the young patients who have underwent this kind of surgery, they have resumed their duties and also their sports. So this will not stop you from playing sports or bending forward. Yes, there will be some time, like after 2 or 3 months after the surgery, you can start this activity. Not immediately. I'm talking about bending forward and playing sports. Yeah, but you can do it.
All right, that's great. How about the one that says that endoscopic spine surgery can only treat minor issues, that you still require open spine surgery for, say, a major herniated disc?
So 90% of the problem in this, 90% of the surgery, what we do is involved with single level disc prolapse, single level compression. So most of the problem can be dealt with endoscopic spine surgery. There are very few selected cases where you can't use endoscopic spine surgery. For example, deformity correction. It's in scoliosis. This is one area where endoscopy has no role. Okay.
What about the one that says that, if your MRI is clear, that means your back pain isn't real? Many people are told this, that it's just psychological. Is that true?
Yeah, back pain, it's a very vague and a very complex problem. Most of the time, you have something in your spine. If the MRI is clear, that means there is something what you are doing is not right. Either your posture is not right, or you are stressed out, or you are not having adequate rest and sleep, or your eating habits are not proper. So definitely 99% of the patient, they have some problem which needs to be fixed. And 1% sometimes it's difficult to even to crack the reason for the back pain, but 99% of the patient can be treated.
So there you have it, myth shattered, facts cleared. Thank you so much, Dr. Kamat, for joining us here today and for breaking this down for us so clearly.
Pleasure. Thank you so much, Heather.
It is incredibly reassuring, I'm sure, to know that spinal issues can now be addressed with less pain, less downtime, and much better precision. For those considering spinal surgery, endoscopic techniques may just be the solution that you've been looking for. If you would like to know more, Dr. Kamat is, of course, available Monday through Friday, 10 a.m. to 5 p.m. at Manipal Hospitals in Donapola, Goa. That's all for today on Health Mantra. Until the next one, stay healthy, stay informed, and don't let fear keep you from getting the care that you deserve. This is Heather saying bye for now. Keep watching Prudent Media.